Watch this.
Capacity at Idaho's hospitals continues to dwindle. And once again, that workload is weighing heavily on ICU nurses and staff. They're telling us why this COVID surge is very different from previous peaks for one reason. As chaos continues in Afghanistan, natives with families still there watch with high anxiety. A Boise family shares their story. First Corona and now West Nile? A spreading virus isn't the only concern for some social media followers. We address fears about mosquito abatement in Ada County by going straight to the source. Right now at St. Luke's at their health system, it's in the process of opening up an additional intensive care unit. Think about that, an additional intensive care unit at a hospital. Hospitalizations are spiking and many locations are hitting capacity. A medical expert from St. Luke's says the current surge in COVID cases and those hospitalizations is more dire than the winter surge we saw back in 2020, because that was before vaccines were available. Katya Stepovic has the story.
We are seeing as high or higher critical care need than we ever have, including our pre-Delta virus surge last winter.
It's hard not to notice the sharp spike on this chart, August of 2021, setting a new record for the highest number of ICU patients hospitalized ever in Idaho. In just 1 month, hospitalizations from COVID-19 more than tripled, starting at 122 in July, up to 377 earlier this week.
We have had situations where we have been on divert, yes. If a patient comes to our ER, we are going to take care of that patient. And if we don't have a bed, we will work to find them a bed.
Last week, St. Luke's announced a pause on elective surgeries to make room for the influx of COVID patients.
All of these COVID patients that are taking up these critical care beds are also, we need to be able to get those heart attack patients into those beds and those stroke patients in too. It's this additional massive volume of COVID hospitalizations that are really putting a strain on the system. But yes, our beds are full.
Dr. Laura McGeorge with St. Luke's Health System says most of the COVID patients in the hospital are significantly younger compared to any other time during the pandemic. And the concern is not necessarily about space, but resources.
It's not just room and physical space. We now have to find extra intensive care doctors, extra respiratory therapists, and extra critical care nurses to fill a unit that we never even had before.
In late June, the state was reporting almost 200 ICU beds available. Today, there are only 90 left, a trend sending us back in the wrong direction, with a future looking not so bright.
What is really striking to me is that situation, seeing that, knowing that, hearing what is going on at St. Luke's, all the work to try to respond to this, and then walking out and seeing things going on that are as if there were no pandemic. I am completely confident that this is going to get worse before it gets better, because based on seeing what we're seeing with community spread and what is going on right now in our communities.
That comment says a lot, because of her walking out, as you said, and people act like nothing's going on. But the question remains, we've kind of seen this on social media, that some local hospitals are diverting patients. When is it going to come to that at St. Luke's?
Well, that is the golden question, and it's one that's really hard to predict right now. And that's simply because the number of ICU beds available changes every single day. So for instance, someone could be discharged, but several more COVID-19 patients could check in. So it's really hard to know exactly when patients would need to be diverted out of state. But like we heard today, that's been done before, and they have met capacity several times in this last month. So it's a wait and see.
But like that chart said, the most ever in Idaho hospitals right now in just weeks amount of time, whereas before it took like a couple months to get like there. All right, thank you, Katya. So we've talked about the numbers, right? The numbers and the data. We've been focusing on this a lot. That's a big part of this, of course, but another crucial piece, the stories that we continue to hear from our frontline healthcare workers. Joe Paris spoke with ICU staff from St. Alphonsus and St. Luke's today. They tell them things right now, as you probably can guess, as bad as ever. But staff says there are major differences for them from the last time things got this bad back in December.
To put it simply, the situation in ICUs across the Treasure Valley is very serious right now.
I'm a therapist that works in all areas of the hospital, and I had to be pulled from my floor assignment into the intensive care unit just because we had patients coming in and being put on ventilators, and we just were having to pull staff in the most immediate needed areas.
Nancy Roberts is a respiratory therapist with St. Luke's. She was able to step away for a few minutes to talk about the situation they're seeing while working in the ICU. We last checked in with Roberts last fall as Idaho ICUs began to fill up with very sick COVID patients. She says it is just as serious now, but has a different feel.
The younger demographic now that we're seeing coming in and that are needing the intubation and the ventilators and the ventilator management, it seems like 35 to 45 is kind of our really sick patients, whereas the first go round seemed to be more in their 70s. It seemed like, so yeah, it's definitely a different demographic.
Dr. Megan McInerney is the ICU medical director at St. Alphonsus Regional Medical Center in Boise. She says she agrees. Things are just as serious as they were late last year, but it does feel different.
It feels very different to me because it's preventable now, right? So it's a very different feel as far as the age of the patients who are coming in. They're getting really sick. There are a lot of people on ventilators and they're not vaccinated. So it didn't have to be this way. And so with that, the air in the ICU is a little bit defeated by the nurses, the doctors, the respiratory therapists, the nurse practitioners, physician assistants. All of the members of our team are feeling a little bit more deflated with this round of COVID surge because it's a preventable illness at this point.
In terms of morale, Roberts says the situation is taking a toll, especially on less experienced employees.
It's rough. You leave here having worked a very hard shift and trying to take care of people, and not everybody makes it. So it does, it absolutely can wear you down. And just knowing that, we're having a hard time keeping staff and having new people hire on is also, those are realities. So we just, we're doing what we can do.
I think my concerns as the ICU medical director are less about, are we going to run out of ventilators, but it's more about, are we going to run out of staffing? Are we going to have enough nursing staff to take care of these patients, right? We're already having to set up and line up backup schedules for the physicians, but we just don't have endless amounts of nurses to help take care of these patients.
ICU beds in the Treasure Valley are getting tougher to find, and there is fear that very soon difficult decisions will need to be made.
Currently, we are not turning patients away. I want to keep saying that, right? If somebody has an emergency, if somebody is having an issue that needs to be evaluated, do not hesitate. Please come. We will take care of you. But we're getting pretty worried about the future if we keep going in this direction.
We're seeing a lot of people dying again, which is unfortunate. We're seeing patients that take a turn very quickly. I personally have had patients on our regular floor, and within 2 hours, I'm asking for them to be transferred to the intensive care unit.
It's not like we haven't been here before, Joe. We've heard this message. We've talked to these ICU staff members and these doctors and these nurses. We could tell they've been frustrated before, but here we are again. And so I guess if we have to ask again, what is the message this go round?
Yeah, well, and I just want to say real quickly, this can be very deflating for a lot of hospital employees where they're in such an intense situation inside the ICU or the hospital they're working in, and then they go out in the community, they go to the store, they go to the mall, and people are acting like it's completely normal. Now, they tell me, Brian, that their message to the community is if you can get vaccinated, please do this, because they say they meet so many people in their ICUs that say, I wish I would have gotten vaccinated, but unfortunately they're at the point where it's too late. Another thing that ICU employees have told me today and over the last few weeks, Brian, is they really ask people to wear a mask, whether it's required or recommended or not. They're saying if you're around other people, please wear a mask. We're seeing so much spread of this Delta variant for how contagious it is, and we know the science works, they tell me, Brian.
Yeah, and if you think you're tired of it, you should talk to an ICU nurse. You should talk to hospital staff, and you'll find out how tired COVID can actually be. Thanks, Joe. They were born in a country now the center of an international crisis. Now, young women and business owners in Boise, they tell us why they are so worried about the home and family they left behind. All right, you know the drill. This is where we want you to be part of the 208 conversation. Text us right now and anytime during the show. Questions, comments, and complaints. And you likely already know the number, but if not, it's on your screen. 208-321-5614. You might also know it helps to include your name and the hashtag the 208. Oh, we read them all, and some we share with everyone at the end of the show. A fiasco, a tragedy, an embarrassment. All descriptions we've heard of what is happening in Afghanistan right now. The Taliban is taking over, and Americans and those Afghanis who helped the U.S. during the nearly 20-year war, they're trying to get out, and they're struggling to do so. Boise has quite an extensive Afghan population, with refugees being placed here since before the war began. Most here still have family back there, and they can describe these last couple of days differently, more of a nightmare. The Shams took their 4 daughters out of Afghanistan shortly after the Taliban took over the country the first go-round in the mid-90s. Going through Iran and Turkey, it took them about 7 years to make it to Idaho. The 4 daughters are now business owners in Boise. But there is another daughter who stayed behind in Kabul. So what's it like to watch what is happening right now and not be able to do anything about it? Mixing meringue, folding phyllo dough, and loading up lemon tarts is how the Shams sisters spend most mornings. It's just some of what they've been doing since opening the Sunshine Spice Cafe on the Boise Bench back in December of 2019. The name comes from the nickname for saffron, an ingredient that flavors almost all their recipes. Recipes that are a kind of fusion of Afghan favorites and put together by Bahar and Katra in the back. While Nargis and Omaira
Would you like a receipt?
No, thank you.
Okay.
are responsible for the front, including the art on the walls. The Shams sisters and their parents arrived in Boise in 2003, refugees from Afghanistan.
So it's gonna be $2.39.
Omaira was just a toddler when she last saw her home country, so she doesn't remember much, except
I remember when the Taliban came, because as they say, like when you're a kid and you experience something horrible, it never goes away from your head. It always stays with you. As I was growing up, I was getting like nightmares of something like that would happen here. But now as the Taliban started to come again, now I know like how I was feeling at that time.
So you're kind of getting those feelings.
It's coming back, yes, yeah. They knock on doors. If somebody has younger girls, they say you have to get married because you cannot go outside without a man.
You're one of 5 daughters.
5 daughters and my parents, yes.
And that's why they wanted to leave.
Yes. So they came and knocked on our door. They said that they want to get married with my sister, older sisters. And that's when my dad was like, okay, this is not going good. we are not safe, we have to flee.
So all of this happening right now and all of these memories flooding back to you,
Yep.
how hard is that?
It's really hard, and especially when I have a sister in Nice in Afghanistan.
When was the last time you spoke with your sister?
We speak over the phone, but we are afraid what if they disconnect the internet and they don't usually have like power 24 hours a day. They only get power like a couple hours a day. So like when they have internet and power, we can speak.
Your sister and your niece, basically on their own, right? Just the two of them?
Yeah, just the two of them, nobody else with them.
What's that like for two women alone in Kabul right now?
It's very scary because like they are not sure if they're safe to go buy food outside. So they're always like in fear of going outside. It's like they are in prison, like house prison, like how you get house prison, that's how they are. They cannot go outside because they fear their life.
Women's rights and safety have always been an issue in Afghanistan, which is a big reason the Sham sisters started the Sunshine Spice Cafe.
And our first intention was to be able to gather like money and be able to send money and help women in Afghanistan. My sister, my niece, they were like a bridge between us. So we would send them money and then they would find families who were in need.
And this saffron tea was going to be the next phase of that.
My niece and my sister was the bridge who they would send like export saffron to us and tea. This is like tea we were going to launch like in a week or so, but because of the Taliban, it affected our business. It affected like how we would help women in Afghanistan. Now we cannot do that.
You were helping people, you were sending money, and now it just stops like that?
Yes. So like when we first started this business, COVID came. We closed like for 5 months. And then during that time, we also lost my dad. So from the beginning of opening this business, we have faced so many difficulties, but we never give up because we really need to help women in Afghanistan. They need our help. Like if we cannot help them, who's gonna help them?
Amira said she graduated from BSU with a degree in criminal justice with the goal of becoming a lawyer, but decided starting this business would be a better way to help those women in Afghanistan. And so far, it was before this week. They've sent thousands of dollars back to Afghanistan. Her sister back in Afghanistan was a doctor who lost her husband a few years ago. Her niece, the exporter, which is how she was able to send the saffron. Amira is worried about what will happen when the Taliban finds out about that. She spent some time on a Zoom call yesterday with the hope of finding out options to help her sister and her niece, maybe apply for asylum here in the United States. Sadly, she said, she can't do much about it at this point. Remember when West Nile was the virus we were most concerned about? Well, it's back, and in a big way, in several places in the Treasure Valley. Most counties have a department that takes care of stuff like this, and usually they do it by putting larvicide in bodies of water or by spraying fog from the back of a truck that just drives through neighborhoods. But tonight in Ada County, they are taking to the sky because they can cover more ground than actually being on the ground. 38,000 acres in about 4 hours, actually, which prompted this text from Kathleen this afternoon. I have some very real concerns about the mosquito spraying Ada County is going to be doing this evening. They're using an organophosphate, the same chemical used to make nerve gas. Is now really the time for this? In the middle of coronavirus, we have to worry about West Nile virus, she's asking. Is this really necessary? On Tuesday, Ada County Weed, Pest, and Mosquito Abatement posted this to their Facebook page, reminding those who live in North Meridian, Star, West Eagle, and Cuna that they will be spraying for mosquitoes beginning around 8:30 tonight. It's a post you can find on Facebook. It'll be in the story at ktvb.com. And it's been shared more than 1,300 times with more than 400 comments. There it is. It includes a map. Most of those comments are concerned people like Kathleen, especially when you start throwing around the term nerve gas. Well, we called the Ada County Mosquito Abatement Office in order to explain some of this. And what we learned, they'd done this type of aerial application before, like back in 2017 during all that flooding after Snowmageddon melted. Remember that? And there was a lot of water around to breed all the mosquitoes. They also did it in 2015, 2013, and 2009. We're told they drop it from planes, and it's a fog with a micron level of insecticide called dibrome. And it's supposed to kill mosquitoes on contact, but if it lands on a surface like a leaf or patio furniture, it's supposed to dissipate quickly. So are we really dropping nerve gas on Ada County residents?
Well, dibrome is in a similar classification, but it's not necessarily a nerve gas. However, the way it's formulated for the aerial application is we're talking about when we do an aerial application, a half a shot glass over 1 acre of ground where we're targeting mosquitoes specifically with minimal impacts to humans, livestock, agriculture, and then, like I said, it dissipates very quickly.
So this evening when you guys are doing this, should people be concerned about being outside during this time?
There are no specific safety precautions that are required according to the label and according to the application methods. However, if folks are concerned, they could stay inside, they could close their windows.
So yeah, you shouldn't be, but if you are, do what you need to do.
Correct. Really, this is kind of an industry standard practice. It's happening in the southeastern United States. These type of applications happen in broad daylight with people walking their dogs and everything as far as exposure goes in that realm. So what we're trying to do is be very cautious about how we do this, but then we also have to take this threat very seriously.
Which brings us to the why they are doing it again this year. It's not that they've seen a huge increase in the number of mosquitoes. That's Adam Schrader, by the way, who works for the mosquito. He's the director of that department. He said it's just a high percentage that are carrying West Nile right now. All 6 cities in Ada County have mosquitoes with West Nile virus, he says. In 40 places where they've had tests, they've had 70 positive tests. Adam told us right now, if you live in Ada County and get bitten by a mosquito, there's a pretty good chance you could get it too. You want to see where they will be doing that abatement? Well, we have a link to a map included in this story at ktvb.com. All right, before we get to your comments, I want to apologize to Adam Schroeder, not Schrader. I misspoke. It is Schroeder, not Schrader. Now let's get to your comments. Jason asked this question. Just curious, when we had this many cases of COVID-19 the first time around, we've been put into stage 1 of lockdown. I don't want to be there, but what is different this time around? Well, Jason, it's one answer, what we just told you about. It's the availability of a vaccine. And as those nurses and doctors tell us, all of this is avoidable. So at least maybe Governor Little now giving us the benefit of the doubt that we can kind of do that instead of forcing his hand. We'll see. Current COVID situation is also very deflating for those of us that have cared enough about protecting others in the community by following mitigation measures, only to have a segment of those population to completely ruin it for everyone, Martin says. And a lot of people feel the same way as you, Martin. We'll see you tomorrow.